During the coronavirus pandemic, telemedicine has emerged as a much-needed way to further connect patients with their doctors. My next guest, Dr. Judd Hollander, will be here in a moment. But let me talk to Bob. Bob, you're a dad. How old are your kids?
I'm lucky because they're not as young as they used to be.
So they don't need you anymore.
They don't need, and I've talked to parents who have small kids. So ours are basically teenagers wanting community college. It's been more of a mental struggle, and I've been fortunate because my mom used to teach the hearing impaired in New York City for 20 plus years. So I had a parent as well as a teacher. I really struggle to see how parents have two jobs, right? And then they've got to also teach. The teachers are so important, and I do think that the next administration or the next term of Donald Trump, the teachers have to be focused more on, because it's either Leslie or Lily who said this is not going to change. This is a new way of life, and teachers. Another point I wanted to raise that I know Lily raised is access, where some schools have a lot of stuff and access to the internet and others don't. And that's where opportunity in this country begins. And if you don't have that, well, then you don't have as much as an opportunity as the next kid. And that's got to be fixed.
Thank you for that. So we're going to go to our next guest. My next guest is Dr. Judd Hollander. He's the Senior Vice President of Healthcare Delivery Innovation and Associate Dean for Strategic Health Initiatives at Thomas Jefferson University. One of his recent initiatives is called Jeff Connect, a service that connects patients with doctors from their cell phones, tablets, or computers. Welcome, Dr. Hollander. Thanks so much for joining us. I mean, the two big areas that many people kind of refer to right away when we think of a hyper-connected world, the world of 5G, what's going to happen, is the transformative possibilities in health and in education. There may be also in finance and fraud. There are lots of other areas that we'll be dealing with, but health is right at the top of people's list of what they want. And we've had this, big change of people engaging in telehealth, telemedicine, having it paid for by Medicare. And I've done a lot of events on this where there's a fear it's going to collapse and back. But why don't you give us your dashboard as you look at this new connectivity and what it can do for us on the health front?
Well, I think it's a really simple concept that people...
Hang on, let me just switch microphones. I'm sorry. I'm talking about how simple it is, and I've become difficult to hear. I think it's a really simple concept for us that we do this all the time, and I don't think everybody knows we do this all the time. You FaceTime with your grandkids. You do text messaging with friends. If you're a physician, you are always reaching out to people, and you are always getting people reaching out and taking care of you. So we did this long before COVID. The trick during COVID was taking those people who had been doing this for a while and really scaling it up overnight. In the Philly area, that was mid-March. And then the second trick was taking people that never did it before and convincing them this was a way they could deliver care. For the last 4 or 5 years, when I would go around speaking on this, I had to convince people this was valuable. Unfortunately, or fortunately, there's nothing like a pandemic to make people see the value immediately. And now I think everybody knows that this is a way care will be delivered forever.
Later in today's program, Dr. Hollander, I'm going to be discussing trust and the challenge of trust in this new world with Representative Scott Peters and some other folks. And I'm just wondering, as people have been shoved into this world, what's the level of trust they have? Because it's not instant, right? I mean, is there a wobbliness in the trust factor as you've seen folks come into both health and connectivity?
So I like to speak of three things: trust, communication, and cooperation. And the way trust played out at the beginning is healthcare providers, right, who make their living, in hospitals who make their money by taking care of people, told patients stay home, because at the beginning we didn't know how to manage patients and their exposures to COVID. So unless you were really sick, we were trying to have people stay away, and that's not what we really want to do. So we developed trust.
That sounds cool.
Yeah. So, no, let me see.
No, go ahead. You're fine.
Okay. All right. So, okay, I'm going to shut off the phone and just do this on the video. So, anyway, so we developed trust so that people would be able to stay away. And I think that's an empowering message when you're a health system. And then now that we know enough about COVID and we can bring people back safely, we've communicating that message and we've developed a lot of trust around that. So when we say you can safely come back, they know that we mean it because we told them stay away before. And then cooperation is tricky because we're cooperating between the patients and the providers, but we've learned to also cooperate between man and machine. And the patients have learned to trust the video. And you see, I'm having a couple hiccups even on this, and we see this on TV and we see this on Zoom meetings, but we're able to get done and deliver the important message. So I think it's the trust, the communication, and the cooperation going forward that gives patients confidence they can get care this way.
Well, believe me, the problems you're having, we're having today too. We're not necessarily at the Model T right now. We're somewhere in between. But I have confidence that this is all going to become much more predictable, a lot more stable. And I appreciate you joining with us. Tell us about Jeff Connect.
So Jeff Connect is our brand name, and the simplest way to think about it is it's all of telemedicine. So before I got to Jefferson 5 or 6 years ago, Dr. Robert Rosenwasser had created a neurostroke network where he and his team could reach out to 30 some odd hospitals and take care of stroke patients remotely. And they would be able to see the patient via telemedicine. They would be able to see the CAT scan via telemedicine, and they would be able to deliver expert care to the patients wherever they were. Right now, they actually have a mobile stroke unit, and we have a goal to try and get the clot dissolving drugs into people when they show up at the hospital within an hour of arrival or within a couple hours of symptom onset. Last week, they did that within 15 minutes or when the ambulance showed up at a patient's curb. So an unbelievable way to deliver care to somebody's house during an acute stroke. That's not the majority of telemedicine. I break down telemedicine in a couple different ways, but one is it the patient who's seeing the doctor? And that's most of the time. Or is it a doctor who's being third-partied in to another healthcare provider to help deliver expert care, like the Neurostroke Network that I spoke about? So Jeff Connect is an app on your phone. If you're in our region, Pennsylvania, New Jersey, or Delaware, or similarly in other regions with other telemedicine providers, you just go on the phone, you download the app, you put in what your medical information is, and in our system, in less than 5 minutes, you're seeing an emergency physician 24/7, 365. You don't need to schedule an appointment. There's docs standing by, and they see you right away. They see you by video. They do what they can do by video, which isn't always everything, but they can take care of about 75 or 80% of things on the video, and then they can coordinate your care and hopefully be able to keep you out of an emergency department and send you to a place where you could get better, more convenient, faster care, should you need in-person care. On the other side of the coin, really important when COVID broke out, was taking care of both COVID patients with chronic medical problems, diabetes, hypertension, all the things normal people get, as well as people that were afraid to come out of their house. And so we geared up, and we had basically the ability to take care of about 2/3 of the patients that previously had in-person appointments scheduled, but now didn't want to come downtown to the doctor. We took care of them by telemedicine, and that was through a scheduled visit program on Jeff Connect. So I think, thinking of it broadly, there's many other things I could talk about, but you could either just get an ER doc round the clock anytime you want, wait less than 5 minutes, or schedule an appointment with your own primary care doc or your own specialist and see them via telemedicine without having to leave your house.
Judd, that's fascinating. We're right near the end of our program, but let me ask you a question. I love the fact that we have you today, and you bring a good practical expertise. We have politicians coming along. Politicians are a little different, But one of the things I've seen from talking to people about diabetes and constant glucose monitors and telemedicine and telehealth is a dramatic change in this time also in, I don't know how to call it, the accuracy of diagnosis has increased in this time with all of the kind of technology that's come on. And that's something many people think, is that maybe visiting that doctor in person wasn't yielding the best and most accurate diagnoses. Now, we can debate that. But I guess my question is, in this world that we've kind of gone into, some insurance companies have begun walking back what they agreed to pay for in telemedicine and telehealth. And I'm wondering if you and your colleagues are feeling that, or you feel like the results have been so robust that you think that the politicians are going to know we can't go back to an era where those new methodologies aren't paid for. Does that make sense?
Yeah, and that's a really complex question because it's not just the politicians, it's the commercial payers as well.
Right.
So I think the response from CMS and from Medicare and Medicaid, they rapidly paid for it, and now there's legislation pending that looks like it will extend it to the end of 2021. If that legislation passes, this is just going to be the way everybody's getting health care between now and then. And nobody will want to walk it back, both the politicians and the patients. So that will move it forward. And I think everybody is generally supportive of it. It's a different world when you get into commercial payers. The commercial payers, many of them had their best quarter ever in terms of profit because there were no in-person visits. There was no elective surgery. And they paid a little bit of money for telemedicine. And now that we're over the peak in some states, they're walking that back. And I just think that is just totally unconscionable. You just made boatloads of money, and now you're dialing back what patients want to save a little money. But the truth of the matter is some of the commercial payers, their responsibility isn't to the patient or the health system, it's to the shareholders. And if you let people have a primary profit motive in healthcare, they're going to do actually what they're unfortunately supposed to do, which is make money. And when you're trying to make money, the less you spend, the more you make. So I'm actually afraid the commercial payers are going to walk it back, but I have all the confidence in the world that 6 months or a year from now, they're going to have to move forward again after CMS sets a good example for everybody. It would be much nicer if they honored the fact that patients are paying them a boatload of money each year to get care, and they just paid for that care to be delivered.
Well, with that, Dr. Judd Hollander, Senior Vice President of Healthcare Delivery Innovation. We should keep talking about healthcare delivery innovation. It's a big topic, and I think it's going to continue to evolve at Thomas Jefferson University. Thanks for sharing with us, Jeff Connect, and your views on this important subject today. We really appreciate it.